All right, so this is our first case study. We're doing some next generation kind of case studies for mother baby. So this first one is going to be, I hope it's the neonatal jaundice. So let's see if this is what we've got. Okay, so with these next generation style questions, yes, Maria Isabel. Oh, you're just waving. Okay. Um, Sorry. Okay. With these next generation style questions, they are one scenario and you'll have 6 questions on them. Okay, so that's what we're doing here with these particular questions. Okay. And I just want to make sure like this setup is a little bit different, but like on your actual tests and your HESIs, you may have tabs. So you have to make sure that you're looking at all the tabs. So you're seeing all of the information, and for every question, make sure you're checking every tab to make sure you don't miss any new information. Okay. All right. So Maria Isabel, do you want to kind of read through our first set of information on this chart, please?
All right, it says the nurse cares for a term newborn on the first day of life on the postpartum unit. I can barely see, but it says nurse, and I think it has her name.
Okay. How's that? Is that better?
Yes,
Okay.
yes. So on the face sheet, it says name, gestation, Wang. Is the name female, gestation 39.5 weeks, weight 6 pounds 9 ounces, blood type 0 positive. And then at 918-hour-old newborn by spontaneous vaginal delivery to a 23-year-old gravida, 2 para, 1 blood type 0 negative mother, uncomplicated pregnancy, rupture of membranes 7 hours prior to delivery with clear fluids. APGAR was over 7 and 9, which was that's because they checked it 5 minutes after, right?
Yes, so they do the APGAR 1 minute and then they do it at 5 minutes again. So that's correct. Good job.
Okay, mom states that breastfeedings are a struggle. Baby has poor latch and is easily frustrated. Mom has sore nipples. General is slightly lethargic, crying with exam, flex posture, visible jaundice, temperature 37.7 Celsius, 99.1 Fahrenheit, heart rate 144, respiratory 48, and then hint morphalgic, fontanelle slightly depressed, eyes and ears normal, set shape, sclera yellow, palate intact, tongue with espine pearls, dry mucous membrane. The respiratory is no murmurs, pulses +1 bilaterally, breast sounds clear, and then GI is soft, non-distended, liver palpable, umbilical stump intact and clamped, past 1 meconium stool voided one time since birth, and then musculoskeletal is hip stable bilaterally, all W and L.
Okay, excellent. Okay, so there's a lot going on here. So let's kind of break down what's going on before we go to the questions. Okay, so this is a patient. So she's at full term because she's at 39.5 weeks. The weight of the infant is a little over 6 pounds. Looks like it's a female. Blood type is O positive. So she had a vaginal delivery and she's 23 years old. She's gravida too. So that means she was pregnant twice, right? Para 1, that means she has 1 living baby right now. And she's O negative. So the fact that the baby's O positive and the mother's O negative, does that mean anything?
Yes.
Okay, what does it mean?
Is that not the mom need that shot?
Yes,
think
what
that's the
is that
shot.
shot? What is that
Is it
shot?
Rogan?
Rogan. Mm-hmm.
Yes, that is correct. So I'm thinking, okay, yeah, probably means the mom's going to need RhoGAM, right? So this is an uncomplicated pregnancy, and so that's very good, Tonya. So a rupture of the membrane 7 hours prior to delivery with clear fluid, so that's good. I'm liking the fact that these APGARs is a 7 and a 9, so it has improved. And remember 1 minute, like Maria Isabel said, so that's at 1 minute, and then at 5 minutes it was a 9. So the mom states that breastfeeding is a struggle. The baby has a poor latch and easily frustrated. The mom has sore nipples. What do you think about that part?
She just
That's
needs some more education.
well, mom has sore nipples too, and it's because of the poor latching. You know, he's pulling on it, wrong, so it's making her sore. Which sore nipples usually mean she not gonna be wanting him to pull so much, so he not getting enough feed.
Yes. Okay, great. And what do we know? Because we kind of know this is about, jaundice. What's one of the things that we need to do for this jaundice infant?
I know you need to go under that light.
I was just about to say the same
Mm-hmm.
thing, the warmer.
Yes, so the ultraviolet lights, okay, so the Billy lights, but those ultraviolet lights is going to be what this infant needs. And also continuing to breastfeed because that actually helps to flush out the system, to flush out all of those extra red blood cells that are breaking down. Okay, so yes, so that's going to be a cause for concern for me, probably, right? Okay. So this infant is slightly lethargic, crying with exam, flex posture, visible jaundice. Does that concern you at all?
The visible jaundice, yes.
Slightly lethargic too, because he got a frontal node that's frontal node slightly depressed, meaning he don't have enough fluids.
That's right. So he's dehydrated or she's dehydrated. Okay, yes. And I'm going to tell you, whenever you see a patient slightly lethargic in real life or in an NCLEX scenario, I'm going to think, okay, why is this patient lethargic? That's really not anything we want for our patients. Lethargic is not really a good sign. Okay, so here's your vital signs, and Tony already pointed out those fontanelles being slightly depressed. Anything else with the head, ears, eyes, nose, and throat?
I don't know what that tongue epicene pearls is. What is that? But I know the dry mucous membrane isn't good either.
Okay, yeah, dry mucous membranes is not good. So here's Epstein pearls. So this is not anything that's like really harmful. Sometimes it happens with older moms that they can have these Epstein pearls. So that's not anything that's really gonna harm. So like if I said that this is like super duper, do I notify the doctor? No, it's not necessarily anything that's gonna harm the newborn.
Does that
Uh,
go away with time?
yes, it can go away with time. And so they're just like dental, they could be like on the gums and they're just like little cysts. And so they should go away with time. Let me see if there's anything else. Um, I think the big thing is just to make sure that they don't get infected. That we just have to look out for that. But that's all there is with that one. Okay, those your Epstein pearls, dry mucous membranes, you already mentioned that. Okay, so cardio-wise, no murmur, pulses are +2, breath sounds clear, the abdomen soft, non-distended, liver palpable, umbilical stump intact and clamped, passed one meconium stool. What does that meconium stool tell us? They passed once. Is that good or bad?
That's bad because they passed it inside, right? In the meconium fluid, is
Uh,
that?
no, they're already born and they passed one meconium already since they've been born. They've
That's a good thing.
So it is a
Yeah.
reassuring thing, yes, and that's a normal finding. Okay, very good. And they voided one time since birth. Now, one time since birth, it's 0900. When were they born? Let's see.
They
0900.
said 18 hours. So we gotta count back.
Okay, so 18 hours and they voided one time since birth. So they're almost a day old and they only voided once. Is that reassuring to you?
No.
No. And they've got these fontanelles, right? So we're connecting all of the dots. So what kind of picture is this painting for you?
Not a healthy baby. Something's wrong. She's
Dehydration for sure, like you said.
mm-hmm.
Mm-hmm. Okay, yes. So for many reasons, because she's having trouble with the latch, we see the sunken fontanelles. Okay, so I think you all have a good idea. So I will tell you if you get these, and I guess not if, but when you do get these next generation NCLEX questions, all of this information in the chart, just like we're kind of breaking it down and looking at it, and we're trying to get a picture of what's going on, you need to be able to do this for every time you get a question. Okay, so looking at all of the information, what's normal, what's abnormal, what's an emergency, what's not an emergency, what requires follow-up right now, what requires follow-up later on, right? And so painting a picture. So you all are doing a great job knowing that the mom can't necessarily breastfeed. There's a problem with the latch. So the baby's dehydrated because of that, the sunken fontanelles, right? So this question, the first question is asking you to drag the 5 findings that need immediate follow-up to the box on the right. And here we have activity level, color, Epstein pearls, fontanelle, mucous membranes, stool output, sclera, urine, umbilical stump, and vital signs. So there's 5 things. What do you think?
All right, so first one would be a stool output, and then I'll let you go, Tanya, and then we'll just fill it out.
Okay. You want me to do it?
Oh yeah, I'll go
Okay.
next after you.
Oh, but so I wouldn't put stool output though. That wouldn't be one of my 5s. I definitely would put color. I would put fontanelle. I would put urine output, mucous membrane, and
The
I'm
activity level.
thinking activity level. Yep. I'm thinking the activity level is that lethargic, but them are the 5 I would pick. But then you tell me what you would pick.
Okay, so I would have picked the fontanelle. That was a big one. I would have thought stool outputs, and she just said one wasn't good. The
No,
activity level for sure, if I didn't already say that. The color
no.
for sure, because there's slightly jaundice. And then
Okay,
the last one, mucus.
mucus. Okay,
The
so
stool is good.
the stool is good, but voided one time. So that's the
That's
urine.
bad.
Okay. So maybe that is because of the dehydration. So there's something,
Mm-hmm. Okay, so yes, so that's right. So the meconium is fine, but the one time they've been alive for 18 hours, so they should have probably at least 5 or 6 wet diapers at this point. So the fact that they only had one, that's a big cause for concern. Okay, so activity level, you all were correct. That is definitely concerning because again, any baby or any patient lethargic, that's going to be a cause for concern. The color is correct, okay, because this is jaundice. Clearly, it's jaundice. The fontanelle, cause for concern. That's dehydration, right? The mucous membranes, again, dehydration. I didn't see, let me see. So this is telling me the urine output is not immediate, but the sclera is. Okay, so let me,
sclera's in the eyes, right?
yes,
Okay. I
okay,
wonder what it said about the eyes that I must have missed it.
Oh, they yellow. I'm sorry, we did. It's true.
Oh,
We didn't
okay.
see it right there in our face. Yep, you're
yep,
right. That was more important than the
Oh,
urine
okay.
output. The
okay,
yellow because of the jaundice.
okay, so I'm gonna put the
Yeah.
rationale in the chat also. So let's talk about this. So, I mean, definitely, I agree though, the urine output is a cause for concern, but if we have the top 5 things. So we're talking about bilirubin, right? So that's the breakdown of your hemoglobin. So this baby obviously has too much of this bilirubin, and so now they're jaundice. So they are jaundice and they have yellow sclera, and so this tells us that they have hyperbilirubinemia, right? So this is pretty significant because high bilirubin can cause brain damage and death. Okay, so that is like super important, okay, for us to take a look at. So this is combined with the dry mucous membranes. It tells us that they're dehydrated. They have a slightly depressed fontanelle that is indicating dehydration and possible hypovolemia. Okay, so hypovolemia and hyperbilirubinemia can cause this lethargy, right, which we see in the newborn. Epstein pearls, they're just small cysts, and they're not really, clinically significant. They're benign. So we're not going to worry about that. They will just disappear over time, usually. The umbilical cord is normal. One stool is normal. And they're saying that one void in one day is typical for the newborn. Okay. And I would say it's typical in this case because they're not necessarily feeding as they should, right? Every 3 hours. Okay. And the vital signs are within normal limits for the newborn. So just to make sure that we're clear, what's the top five? The activity levels, the fontanelle, the sclera, the color, which is jaundice, and then the mucous membranes. All right. Any questions about this one?
No, but I do have one. Is there any way that you could show us the rationale on this page? Because when I watch your videos, it says in the chat, but I can never see them. Like I can never see the rationales when I
Oh,
go back to
See in
watch
the
the
bottom?
video.
yes. I don't think I can share it
There's
here.
no way to show it.
Let
Okay.
me see if I could do a text box.
I see it in the chat where you put bilirubin is produced by the breakdown. Click on the bottom. It says chat on your
Yeah, no,
screen.
when I go back to watch the videos, like when I be watching her and Erica
Oh,
videos, I can never see the rationale. And I know people who gonna watch this. But yeah, that's great. That's great. Yep.
Okay, awesome. Yeah, thank you for that
oh, there you go.
because I didn't think about that. So I'm glad that you asked for that. Okay, thank you.
And
Okay.
Miss Ignacio, okay, so I did
Yes.
have a card on here that I wrote about having jaundice. I'm sorry, my screen does that. So
Okay.
I did put that whenever somebody has jaundice, the goal treatment is to decrease the level of unconjugated bilirubin. So that's always going to be for jaundice. You want to get the bilirubin down because it's high, right?
Yes. And in the
Okay.
newborn, the way to do that is to give them a lot of breast milk because that will help kind of flush it out
Okay.
of their system. And so and I think the future questions are going to be geared towards that. So I don't want to give away too much. But that's going to be one of the interventions you would think for it.
And you did mention hypovolemic shock. So that if, let me see what this card says.
Can I ask one question right fast?
Oh yeah.
Yes.
So go you, Isabel.
Oh,
You want to do yours first? Oh, so one question: if we had kept the wrong thing, if we had kept, let's say the urine output, what would happen? The test will score us wrong on that answer,
Okay. Yeah. So that's a great question.
right?
So
What happens if you pick one wrong one and you move forward? How would it just? Is there any way to? I don't
um
know what I'm trying to say.
yes.
I want to
So
see how it would work if I pick one wrong question.
You're trying
okay.
to see like the scoring, how it would score you.
No, like what would happen? Like, okay, let's say we put urine output and we didn't put the eye color, right? When you go
Mhm.
to your next question, how does it? Does it compensate for that wrong answer?
So this one, the scoring rule is 0, 1. So let me just make sure I'm telling you the right thing. If it's 0, 1, you have to get all of them correct in order to get all of the points for this
Oh,
one. Yeah, so this is a 0-1, and I'll double check, but I'm pretty sure that that's what the 0-1 means. Now there are some questions that you're going to see, like the extended select all that apply, that if you get, like, if this was and there's one that's coming up, but if you get like 4 correct, then you'll get 4 points out of 5. But if you get one that's incorrect, then you're going to actually lose points. But this one is like an all or none kind of thing. So you have to get all 5 of these correct. So it's the 0-1 rule for scoring, if that makes
Okay.
sense.
So
Okay.
what happens if we had kept your output? We
We
wouldn't
would
get no points for this one, but on the next question, would we be able to answer it correctly by picking something wrong?
That's a great question. So let's see.
Okay.
Because I understand what you're asking, but I think you'll have to see when we get to the next one.
Okay.
Um, because each question kind of builds, but you can kind of still think it through. So let's see. So this is question number 2. So always look for any new information, look for new tabs depending on how it's set up. Like this particular set of questions is yellow, so it's kind of easy to see if there's a new yellow kind of thing, but sometimes there could be a new nurse's note, so always check for that. I think on Evolve and HESI, it will be a new tab that's going to be to the right of the initial tab. Okay, so it looks like there's no new information. Okay, so we're going to now go to this one, and this is a different kind of question. And it says for each client finding, click to indicate it is a risk factor or not a risk factor for jaundice. So what is leading up to this patient possibly having jaundice? That's basically what it's asking you. So breastfeeding problems, is that a risk factor or not a risk factor?
I'm gonna say yes.
Oh yeah, I
Okay,
said it was muted.
okay. Current hydration status, risk factor or not a risk factor?
Yes.
Okay, so it's a risk factor, y'all saying. Okay, maternal blood type, is that a risk factor or not a risk factor?
I don't think so.
Yeah, I would have said no.
Okay,
Wait,
le-
the mama was O and the baby was, I don't know if that's a risk factor for jaundice. I know it's a Reuben,
Positive, the opposite.
yeah. But is that a risk factor for Reuben or just a regular like risk factor? Just
I mean, I
okay,
know it's important, but for the
right,
next baby, that's to my understanding,
right,
it's yeah, for the next
okay,
baby it would be a risk factor.
okay.
Oh, but this is the second baby.
No,
Because the first one was a miscarriage.
no,
Right, Miss Ignacio? For
so
since
so you all are onto something because she's gravida 2, para 1. So she only has one living baby, this baby.
okay,
so I would
right.
say yes.
So she been pregnant twice, but she only got one living baby, which is this baby. So you're right. Since she had one miscarriage or abortion or something, or huh?
Mm-hmm.
Because
Okay.
you have to give Rogam to protect the second baby if the mom lost the first one. If that makes sense. I don't know. I'm not
Yeah,
a good
no, you all are doing great. You all are doing great. So let me ask you this. So is the maternal type a risk factor or not a risk factor?
I want to say yes.
Okay, so you're saying it's a risk factor. Okay, the length of the rupture of the membranes. And I'll go back because I think it was 7
7
hours.
hours.
Is that a risk factor or not a risk factor?
I want to say no.
Okay, so you say not a risk factor. Okay, the fact that this is a second pregnancy, is it a risk factor or not a risk factor?
The thing is, we don't know why she lost her first baby. So we're kind of like, what if it was like maternal problem or if it was just an abortion? So I want to say no on the second.
Okay, and then the current stooling pattern, is that a risk factor or not a risk factor?
No.
No.
Okay. All right. So you all did pretty
Hold
good.
on. My thing is, okay, breastfeeding I know is a problem for jaundice. I'm gonna go back to the question. Jaundice. I don't think a mother blood type is a risk for jaundice. Because I know mothers that have regular blood types and they still, their kids still could get jaundice. So maternal blood type, do O negative increase the jaundice? I ain't never heard of that, but I'm not for sure. But
Okay, now
okay.
is that the only thing with the blood? The fact that she's O negative, but what is the baby?
Positive. And that's a risk factor for jaundice?
Okay, so let me ask you this. What happens? Why does the infant get jaundice?
Because of you said the blood,
Bilirubin.
yeah, the bilirubins.
Mm-hmm. All right, so
Low.
I put the rationale in the chat, and so I'm
Okay.
going to put a while you all are looking at that, I'm going to put the text box, and I thank you for that idea. That was so awesome.
Okay.
Okay, let me
So
try.
this one, the bilirubin's high, so we got to get it low. That's what happens whenever they have jaundice.
So let me see.
Right,
This
Miss
can come
Nosy?
from increased
Yes.
milk
Okay.
and or delayed excretion.
Oh. Okay, wait, let me try to get this text box in a good spot. I don't think I can. All right, let me try it again.
Just do undo.
Okay, wait. Let's see. All right, let me clear it and try. Oh, I should have did undo. I didn't see it. Okay, I'm gonna try to put it over here.
Yeah, put it on the other side.
Okay.
Yep.
Okay, let's see if I can move this. Okay. All right. So at least that's some of it. Okay.
Yeah.
So let's talk about this kind of one by one. So this, when we talk about this baby that's jaundice, right? We know that it's because of increased bilirubin production, right? Or they're not able to excrete all of the bilirubin. We know that bilirubin is a byproduct of broken down red blood cells, right? So, this baby with this high bilirubin, they may have a lot of red blood cells to break down or the unconjugated bilirubin. The problem with this unconjugated bilirubin is that it has to be taken to the liver, right? And so now there's too much of it. Now, if this newborn is not getting adequate breastfeeding, right, that's inadequate intake. So they're going to be dehydrated, right? And so they're not going to be able to flush out these waste products out of the body. And we know that this infant is dehydrated because of the dry mucous membranes, the sunken in fontanelles, right? And so again, they're not able to get rid of the bilirubin. Now, this RH incompatibility, the mom is RH negative and this baby is RH positive. So what happens is these antibodies are going to attack the infant's blood cells, and then the blood cells will lyse, they will rupture, right? And so this is a hemolytic anemia. And again, we know that the liver is responsible for breaking down these red blood cells. So I think you all are right when you said, okay, she was pregnant twice. We don't know what happened to the first baby. And she probably should have gotten a RhoGAM shot beforehand because now this is her second baby, and this could be one of the things that has happened as like a side effect. Okay, so the antibodies will attack the infant's blood cells, the cells are lysing, and then it will happen in the subsequent pregnancies. So they're saying that passing one stool in the first day of life is okay, and it's not a risk factor, and the length of the rupture of the membranes was typical, and that's not a risk factor. Okay, so let me make sure I put the correct answer choices. So breastfeeding, yes. Hydration status, yes. Maternal blood type, yes. Length of rupture of the membranes, no, not a factor. The fact that this is her second pregnancy, yes, that is something to be considered. And then stooling pattern is not a risk factor. Okay, any questions about this one?
I was kind of on the line about the second pregnancy because of the ROGAM thing, but okay, that makes sense.
Yes, so let's talk about ROGAM for 1 second. When should a mom in this kind of scenario receive ROGAM?
If she's negative and the baby's the opposite. And if it's her first one to protect the second one.
Right, and at what time frame? When in the pregnancy or after pregnancy, post-pregnancy?
Before. I think it should be 35 weeks and then right after having the baby.
It's actually 28 weeks. 28 weeks and then after delivery.
okay.
28 weeks. Okay.
ROGAM.
Yes, ROGAM. All right. Very good. All right. I'm gonna go to the next one. Ms. Tanya, do you have any questions or any comments about this one?
Nope.
Okay, good. Maria Isabella, anything else?
Okay, so ROGAM 28 weeks and then not anymore at all? Or
Yes,
again?
after delivery.
Okay, all right, thank you.
Okay, you're welcome.
To protect the next baby.
Yes.
Okay.
Because, and let me just, because I have to look this up to make sure, it's erythroblastis fatalis is what can happen with the next subsequent pregnancy. Let me just look it up to make sure I'm spelling it right. Hemolytic disease of the newborn. Okay, and that's what they were talking about with the lysis. So I'm going to put this in the chat. Erythroblastosis fetalis. It's also called the hemolytic disease of the newborn. Okay, and let me just put the full definition in the chat so you can see it, and I'll try to do another window on the screen. Okay, so because that could be an NCLEX or a test question also. Let me try to do a chat window over here and see if that works. Okay, any questions about that one? Erythroblastosis fetalis? Okay, fantastic. I'm just going to pause for a couple seconds in case anybody's watching this video in the future.
We'll pause.
Okay, and then we'll go. Okay, let me clear all drawings. Okay, then we'll go to the next question. All right, so this is question 3. So the nurse should be cares for a term newborn on the first day of life. So this is the same thing. So the same phase sheet. The nurses know, again, we got to make sure that we look for any new findings, right? Always look every time you have a question if there's any new findings. History and physical, nurses notes is the same. Now we do have something new, right?
Yes, labs.
Yes, the labs. So do you want to read the labs for us, Tonya, please?
The total bilirubin is 16, and that's high. Direct anti-globin test is positive when it should be negative. Hemocrat is 39%. And for a female, it should be between 35 and 47. So that one is okay. Hemoglobin is 13, and for a female, it should be between 12 and 16. So that's okay. So our issue is the direct anti-globin test and the total bilirubin. So them the two things we need to look at.
Okay.
I feel like I could be wrong.
Okay, no, I think you're doing great with your reasoning. Let me see if I could get everything onto one screen so you can see this. Okay, so the nurse reviews the lab results. Complete the following sentence by choosing from a list of the options. The client is, go ahead.
I'm sorry, the client is most likely experiencing, and our option is breastfeeding jaundice, pathological jaundice, or psychological jaundice.
Physiological jaundice.
I'm sorry.
That's okay.
So, I mean, what you think, Isabella?
Can you say them one more time again? I didn't get them.
Let me see. I got away from Miss Nasia to
Oh,
click the button
I'm
for me.
sorry. Okay, there you go. Can you see it now?
Yes. So it's
Okay.
breastfeeding, pathological, and you said psycho or physiological.
Physiological. Yes.
Physiological.
Now I want to say breastfeeding just because the baby's not getting breast milk, and that would help in this situation.
I want to say pathological.
Okay.
I don't know. I think path because the test results, but it could be because I don't know.
Okay. So I like the discussion and I'm trying to find something that has all three types so we can talk about all three types.
Okay.
But let's see. I'm trying to find like a Mayo Clinic, but it's not. Okay, let's see. I'm gonna bring this to this view. All right. So what causes jaundice, right? And I'll put this in. This is from Baby Roo. It's not like Cleveland Clinic or anything. That's what I was kind of looking for. But so here's the three kinds of jaundice,
Oh.
okay? Pathologic jaundice, most serious type within 24 hours after birth, and we know that this newborn is 18 hours old. Rapid rise in baby's bilirubin, most likely causes blood incompatibility or liver disease. Prompt medical attention is necessary. Blood transfusion may be required. Breastfeeding can continue during treatment. So that's your pathological jaundice. And that's the most serious one. Okay, physiological jaundice appears 2 to 5 days and it appears at 2 to 5 days of being alive, right, after being born, and it lasts 10 to 12 days. So the best treatment is going to be frequent and effective breastfeeding, 8 to 12 more times in each 24-hour period. So they can give glucose water formula. No, they won't. I was going to say, wait a minute, that's not right because you shouldn't be giving water to a newborn. So giving water, glucose water, or formula supplements won't help because they lack the laxative effect of colostrum. And colostrum is that liquid gold that the mom produces, and it's golden color before the milk actually comes in, and it really helps with everything that that newborn needs. And so it's around for 24 to 48 hours. Okay, so instead they can interrupt development of the mother's milk supply and increase the risk of weaning. So with your physiological jaundice, again, breastfeeding is going to be what they want. They want to push. When we say push fluids, this is how we push fluids in our newborns, right? Push breastfeeding. Okay, so breast milk jaundice, although breast milk jaundice is often quite rare, it causes concern because what happens is unclear. So there may be differences in the infant's reabsorption of bilirubin or in the mother's milk. Breast milk jaundice can appear 2 to 5 days after birth. Bilirubin levels peak 10 to 14 days and may remain high for weeks, such as months, and such as 3 months. Okay, so they may suggest supplementing breast milk with donor breast milk or formula until the jaundice resolves. Okay, and in some cases, rare cases, they may interrupt breastfeeding for 24 hours to kind of get that bilirubin level down. Okay, so those are the three kinds of jaundice. And so of note. And so of course the pathologic jaundice is going to be the one that's the most cause for concern. That's like the serious one. All right, let's go back to the question to see, based on these lab results, do you think that is breastfeeding jaundice, pathological jaundice, or physiological jaundice?
So I'm going with the pathological one.
I think I am too because it said the breast milk one doesn't appear till 2 to 5 days after. And the baby's only 18 hours.
Okay, great thinking. All right, and what does it do to? Poor intake, hemolysis, or impaired excretion?
Or intake.
Okay, so you say poor intake. Okay, and Miss Tonya, do you agree with that?
I don't know what hemo is. Hemolyl. I think it's that one.
You think it's hemolysis?
Yeah, I don't know what it is though.
Okay, well, you're right. So when we think hemo, think blood, and lysis thinks breaking. So this is actually the breaking down of the red blood cells, and that's what it seems like, right? That's happening in this particular situation. And I'm going to put the rationale here with the different kinds of jaundice as we kind of talk through it, and it's also in the chat. Okay, and I'm sorry that I think that is my rice cooker in the background. All right, so visible jaundice on the first day of life and the high bilirubin level rising more than 5 milligrams per deciliter may indicate pathological jaundice. And so this baby's total bilirubin was 16, right? So that's definitely super high. Okay, so the direct antiglobulin test shows that there is maternal Rh antibodies adhering to the infant's Rh positive red blood cells, lysing the cells. That means breaking the cells apart. So this is another thing that tells me that she should have gotten RhoGAM the first time, but something happened and she didn't. So that's what's happening in this case, right? So untreated, this will lead to hemolytic anemia and possible kernicterus. Okay, so in this newborn, okay, and when we think about this, poor intake or excretion can complicate the problem, but is not the underlying cause of the pathological jaundice. Okay, so let's pause for a second to talk about kernicterus. Okay, so when we think about kernicterus, this is brain damage that can result from high levels of bilirubin in the baby's blood. Okay, that kernicterus. Okay, so this client is most likely experiencing pathological jaundice as evidenced by that total bilirubin that is way over the reference range of 5. Okay, and it's due to the hemolysis, the breakdown of the red blood cells. Okay. Um, any questions about this? Because there's a lot going on in this one question. Okay, and I'm just pausing. I see Maria Isabel taking notes. And I'm just going to put in the chat, there's a link. Oh, wait, that's not the right link. Hold on. About kernicterus and jaundice, just in case. Okay, and Maria Isabel, tell me when you're ready for me to go to the next one, please. Oh, wait, that didn't go through.
I'm ready. I just had to write down the bilirubin
Okay.
ranges.
Okay, awesome. Okay, let's go to the next question. All right, so again, I'm looking to see if there's any new information, any new nurses' notes, any new lab report. It looks like everything is the same. Okay, so so Maria Isabel, do you want to read this question for us, please?
Okay, the nurse contacts the physician with the assessment and lab findings. Select the nursing actions for each of the categories the nurse should anticipate, including its plan of care. Each category may have one or more nursing actions. Then phototherapy, eye shield, monitor temperature hourly, kangaroo care, monitor phototherapy light level. And for nursing is lactation consult, encourage breastfeeding every hour, and supplement feedings with infant formula and weigh diapers.
All right. Okay, so what do you all choose for each of these categories? What should I select?
Monitor phototherapy light level, lactation consult for sure, encourage breastfeeding, supplement
So
feeding.
encourage breastfeeding every hour.
Yes, I know it should be every 2, but in this case, I mean, breastfeeding will help. Supplement feedings with infant formula. That's kind of hard because if the baby's not latching on, then we have to think of a plan B.
Okay, so you're saying to choose that?
Yeah, that would be another nursing action I would take if the baby's not latching on. And then weigh diapers.
Okay, and then wait, so all four, okay. And for phototherapy, anything else?
I'm not sure what kangaroo care is.
Okay, I won't say anything just yet. I'm gonna ask Miss Tonya, what do you say?
Okay, so for photo, I know he needs that eye shield when he going for that jaundice care.
Mm-hmm,
Um, I don't know if you monitor temperature hourly, but I think you have to monitor the temp because you don't want him to get too hot.
mm-hmm.
And oh, I'm with her. Do you encourage breastfeeding every hour? I don't know if I would supplement feeding with formula if I'm trying to get the breastfeeding every hour. Like some of them sound good, but some of them don't sound bad. Let me see what the question said again. Can I go back up a little bit? The nurse
Yes,
consult a physician with assessment and lab finding. Okay, select the nurse action from each of the categories the nurse should include it in a plan of care. Each may have one or more nursing actions. So this is for the plan of care. So
yes.
he definitely gonna need some eye shield. Monitoring the temp is good.
Mm-hmm.
Monitoring the light is good. Lactation counseling is good. Encouraging. I have an issue with supplementing feeding with infant formula. And I don't know if that's a positive or a negative thing. I know that how important breastfeeding is. I understand
Mm-hmm.
that, but the baby is dehydrated. So I would just keep it. I
Keep it
keep
as
them.
this.
Yeah.
Okay, so you all did, okay. So let's talk about some of these things. So when we think about this baby that's under the Billy lights or phototherapy, right? We are not going to put any lotion or any ointments or anything on their skin because they can actually bake. It's really hot under those lights. Okay, I'm trying to bring a picture of the light so you can see it. Okay. So we do have the eye shield. That's important. My daughter was in the NICU and I still have her eye shields from that time because it can actually cause retinal damage. Okay, it can lead to blindness. The only thing, and this one has on socks, they should only have on a diaper. So that's quite interesting. But again, no lotion on the skin, definitely not any Vaseline or any Eucerin, anything, because again, we'll be baking the skin. So this is what it looks like when they're under the Billy lights, okay?
My
Uh,
nephew didn't even have a diaper on. He was born in 2005, but he was naked. They did not put no diaper, no socks, and only the eye goggles. So I'm surprised he even see a diaper on the baby, but maybe
uh,
things have changed in 2005.
yeah, well, I think they need to have the diaper. Of course, for sanitary reasons, that's number
Mm,
one.
mm,
And I don't remember offhand. I think it's something if they're circumcised or not, but I'm not
okay,
sure about
okay,
that. So
okay.
disregard that part. But um, I'd have to double check on that one. But so they definitely need the eye shield. We definitely will monitor their temperature hourly. And what is kangaroo care? Kangaroo care is skin to skin. And
That's when
and
you put the baby to mommy. So yeah, they kind
Okay.
of go up in her chest to get the skin to skin.
right. And it could be mom, it could be dad, it could be grandma, because sometimes the moms are not available, right? So but that is kangaroo care. In this case, they can't have kangaroo care. They need to be under the lights. Kangaroo care is going to be more so if they're a little more stable than what this newborn is. And we're trying to help regulate their temperature, and we're trying to, encourage bonding because maybe the mom is having some trouble with the milk production. So that's another reason for kangaroo care, but that's not going to be appropriate in this case. Okay, and monitor the phototherapy light level, yes. And so we have to take the newborn out of the Billy lights to actually assess them, right? And we do have to weigh the diapers, right? So when we think about the nursing, we are going to consult the lactation consultant. That's going to be an important thing to do. We're not going to breastfeed every hour. Okay, that's going to be too much. That's going to be too frequently. Usually it's going to be every 3 hours for breastfeeding. Okay. Supplement the feedings with infant formula. We're not going to be doing that. We're going to try to continue with the breastfeeding, but we are going to weigh the diapers. That's going to be an important intervention. Okay. And let me put the rationales up here in case anyone is looking at this. Okay, I'll try to put it over on this side. Okay, so these phototherapy lights can cause retinal damage. Okay, and I put it into the chat. And let me see, I think we talked about everything. So these phototherapy lights, they can damage the retina, hyperthermia, bronze baby syndrome. Okay, basically they're burning their skin. So dehydration is another risk. And so the baby is not to be removed for more than 20 minutes every 3 to 4 hours. Okay, so that's why feeding every hour is not going to be the right answer. Okay, so and this is the kind of thing where you want to cluster the care. You want to keep the infant in under those Billy lights as long as possible without interrupting them. When you do take them out, then you feed, then you change the diaper, you do everything at once, okay? And it has to be done within that, short time frame. Okay. Any questions about this one?
No, that does make sense. I remember when Tanya said about the eye shield, I should know because my nephew, we got to watch him now. We can watch him and under the light. That's every
Okay.
time we watched him, he always had his eye stuff on.
Okay, so he's in the NICU now, or he was in the NICU?
No, he was a year ago.
Okay, all right, he's doing a lot better then. Okay.
Oh yeah.
Awesome. That's wonderful. All right, let's go to the next question. All right, so this is again, every time we look for new information, this is question 5 of 6, so we're almost there. No new nurses notes, no history physical updates. Lab results are the same, no new things there, but we have new orders. Okay, so Maria Isabel, do you want to read the orders for us? Let me make it bigger.
All right, so it says orders to start phototherapy, 3 banks of light per protocol, obtain transcutaneous bilirubin levels every 2 hours of uncovered skin, obtain serum bilirubin every 6 hours, lactation consult, strict INOs, and then VSQ every 1 hours, and vital signs every 1 hours and 2 hours, then 2 hours. The nurse has received orders and updates the plan of care. Click to specify if the nurse should implement the orders immediately before the end of shift or by discharge. So we have immediately start phototherapy, lactation consult immediately before the end of shift or by discharge. Oh, yeah, I can say, yeah, I would have said immediately on that one.
Okay, I'm sorry.
Parent education on use of phototherapy. That would say by discharge on that one. Parent education on follow-up labs by discharge. Parent education's RH incompatibility. I would wait on that one. Let me see. And then obtain transcutaneous bilirubin. The lactation consult I would start immediately to help her out. Let's see, which one are we on? Parent education RH. I would say before the end of shift on that one because we do want to educate them on that since they didn't get it the last time.
You said by end of shift, I'm sorry.
Yes.
Okay.
And obtain, I don't understand what that obtain transcutaneous bilirubin. Oh,
Yes.
oh yeah, that's a yes because they're high on it, so they need to be low. Is that
Okay.
what?
Yeah,
I
so
just don't know what that word is.
they're just gonna draw the labs for the bilirubin.
Okay, well that immediately.
Okay, so these are your answers that you have selected. Okay, and I'm gonna go to Miss Tanya now to see if she would keep them the same or would she do anything differently.
So I'm gonna keep the photosynthesis immediately, the lactation immediately, parent education on the use of photo immediately. Immediately for the by the end of the shift.
Okay, for
Parent,
the
that one immediately.
the
The
labs
parent education on follow-up labs. To
is
me,
end
parent educate.
or
Yeah, I'm
did
gonna
you
put immediately for that one.
okay.
Parent education on that could be by the end of the shift or by discharge, either one. But I put by the end of the shift.
Mm-hmm.
Obtain, and then that's immediately.
Okay, all right. So everything you changed a lot of it. Okay, so
Sorry.
no, that
No, I agree with you. Once you did, I
Right,
don't know.
because the
Once I hear
parent,
it,
yeah, the parent education on what's happening to her baby, that
yeah.
has to be to me done. Parent educational follow-up lab. Honestly, she still needs to know, okay, that, your baby's gonna get some more lab work done. It's like it just notifying her because this is happening to her baby right now. And so to me it's important, but I mean, I don't know, via the NCLEX world.
I agree
Okay.
with the phototherapy. Once you said it, yeah, because you do want to make sure let the parents know what's going on.
Of course, should
okay.
be immediate. Okay.
So here's a rationale, right? We're going to start
Yeah.
this phototherapy immediately. So that's true because we know that, okay, this can lead to further complications. The lactation consultant, that's not immediate, but that's by the end of the shift.
Mm.
Okay, so, all right, let me stop here. So that's going to be by the end of the shift. Now, educating the parent, that's going to be by the end of the shift because this infant, they're probably going to be on this phototherapy for more than this shift, right? It's usually not just okay, 3-4 hours and then you're good to go. It may take a little bit longer. So you have some time to explain to the parent so they can understand what's going on. Okay, parent education on the use of phototherapy. Okay, parent education on the follow-up labs. Okay, well, it's going to be follow-up labs by discharge because there's going to be probably once they get out of the hospital, when they're discharged, they need to know when do I have to come back again? What are the signs and symptoms I need to look out for, in case there is something that happens again, right? They have to understand the jaundice of the skin and the sclera, right? That scleral icterus. So that's going to be by discharge. Patient education on RH compatibility, that's going to be during the shift. And that transcutaneous bilirubin is going to be during the shift because we need to know, do I still need to um keep the baby under the billy lights? Are things actually, is the bilirubin levels going down? Because we want to see that bilirubin going in the downward kind of direction. So by the end of the shift, we need to know that, and then update the physician, especially if it's actually getting higher, because then that they're going to have to change their treatment plan. We're going to have to figure out what's going on, because again, the increased risk for brain damage. Okay, so let me just make sure. So immediately before the end of the shift, before the end of the shift, by discharge, and the rest are by the end of the shift. So these are the correct answers for this choice. Any question about this one?
I was just gonna say for the follow-up labs one, I would that I make it makes sense to be at by discharge because you want to make sure you educate them because since it says follow up.
Mhm.
Like,
Yes.
ugh,
Okay. And this was a tough one, I think,
yeah,
right?
it was. Yep.
I agree.
Okay, but I like the fact that y'all are working through it, because when you see this for your test, or if you see it for next generation NCLEX, it won't be foreign to you. And that's going to be, I think, the key thing here. Okay. All right, let's go to the last question. All right. So, and I'm going to remove that. Let's see. You've got your, everything is the same here. Oh, there's some new nurses notes.
Yep.
So let me go ahead and clear this so you can see the new nurses note. So Tony, do you want to read the new nurses note, please?
Yes. So 09:30 phototherapy started. 10:30 temperature was 37.2 Celsius, 99 Fahrenheit. Heart rate 140, respiration 42. At 11:30 the temperature was 37, which is going down. 98.6 is the Fahrenheit. Heart rate has increased to 144, and the respiration is going down to 40. So the lactation consult worker is it worked with mom. Latched and breastfeed in 10 minutes, voided 10 milliliters, and passed a meconium stool. Um, trans whatever that
Cutaneous.
cutaneous bilirubin is 18 milligrams per deciliter. The eyes, the scleras are yellow,
Yeah.
backward arching note. So somebody, the baby's backward
Yeah.
arching noted.
Yeah.
Okay, so
Okay, let me
okay,
just
backward arching.
infant, because I want to make sure you understand what that is saying. And
Like he's arched back.
yes.
But why?
Yeah, that's the thing. I don't know why. That's
Okay, let me see if I can find a picture.
So the temp is going down. His heart rate is increasing. His respiration is decreasing.
Okay,
Mom has got
so
calcium.
I want to, let me show you this. Wait, come on, picture. Or let me show you this, what we mean by the arch back. Okay. Okay, so this is what we're talking about, this arch back. Okay. So you kind of have an idea of what this is, what's going on. Okay. You can get a visual. Okay. Um,
Is that a
so
stretch?
it's not a stretch. It's not,
Okay.
it's not reassuring. I'll tell you that.
Okay.
It's
Thank
not.
you.
Like, no, it's not a
This is
reassuring
above my
sign.
maternal level. I didn't get all this.
I know, right? It's the
I'm the
first I'm seeing.
LPN. I'm like, whoo, these questions got
Yeah,
me sweating.
so that is definitely not reassuring, okay? And
Okay.
so everything that you were reading, like, so let me ask you this. And so based on what you read, do you think that their condition is improving or, not? And this is basically what the question is asking you, right? So I'll let you go through the question so I don't say a lot.
You want me to do that one? The
Yeah,
nurse
go
reassessed the
ahead.
client 2 hours after starting phototherapy and implementing the treatment plan. For each finding, click to specify if the finding indicates that the client status has improved, declined, or is unchanged. So we know the yellow eyes is unchanged. We know the posturing has declined.
Okay, I'm sorry, posturing
Yeah,
decline.
the yellow eyes is unchanged. They had that one before. One more
Okay,
down. Yellow,
yellows
yeah, that's unchanged.
unchanged. Okay,
Can you go back up? Did mom start breastfeeding or did she just get a consultant?
okay. Let's see.
Lactation consult work with mom. Lactate and breastfeed in 10 minutes. Yes. So I think that's an improvement.
Okay, breastfeeding is an improvement.
And total bilirubin level. Gotta go back up for me one more time.
Yes, of course.
Um, okay, so the bilirubin 18, and then down here, oh, that's not it. That's bad. It went up more. That-
Let me see. Did
Right? It
they?
went from 16 to 18.
Let me see if I'm missing it.
Is that what that means? Trans
Every 2 hours. I'm trying to see what they said it was.
before.
Billy
Because they
Rubin.
saying total was 16, but at the top, her note said 18. Or is that something different?
Wait, I see 18-hour-old newborn.
No. Look
On
at
the nurse's
11:30.
note.
Oh,
On
yes. Okay.
11:30.
So, yeah, so transcutaneous bilirubin is 18, and
Right,
that was at 11:30.
right. And it was at 16 at the 0900 note.
Yes, so it's actually getting
Worse.
higher.
Right. It's getting bad.
Yes.
It's right.
Yes. So
So
good catch.
that's declining.
Yes. Okay, so you're saying declined, improved, unchanged, and posturing is declined. Okay, all right. So that's what Tonya says. Okay, super. Let's go to Maria Isabel. What do you think? Would you change anything?
No, I agree with everything she said. I would have put the same thing.
Okay, awesome. So actually, those are all correct. Okay, so this is pretty significant. This back arching, that is not a good sign. Okay, that tells us that there may be neurological damage. Okay, that's what we're telling. That's what's possibly happening. So overall, this scenario is going downhill. Okay, so the bilirubin, it's the value is increasing, so that means the condition is declining. The breastfeeding has improved, right? That's, a positive, but the sclera are still yellowing, still yellow, right? That's scleral icterus, and the posturing is something that's new, but again, that tells us that now we have brain damage, we have neurological damage, and that's what we were afraid of, right? That kernicterus.
Yeah.
All right, let me put that in a text box in case. Okay, so that's like really important to understand what's going on with this patient. So this is a kind of a rough scenario. Um, a,
Right.
a lot of things are going on in this scenario. Okay,
Yes.
a lot of things. And you've been a trooper, Tonya, because I know this is like a pretty intense scenario. But I think it's all pretty significant. So if you see something on your test, it's probably not going to be as challenging. So you'll definitely be able to ace it, I think.
Okay.
Okay, I think Maria Isabel went to get a drink, and I
Drink.
think
Yeah.
this was the last question
Okay.
anyway. I think, yes,
Yeah,
for
that's
this
6 or 6.
particular scenario. All right, so I'm gonna stop right here and I'm gonna see if she has any questions. Do you have any questions about this scenario?
Nope.
Nope. Okay, I'm prepared to do another one. I just want to see what she wants to do.
Okay.
So let me